modifiable. Is it clear? Now, for the modifiable risk factors, for the non-modifiable first, you have age. You need to know that age which is greater than 60 years is already a cardiovascular risk. Is it clear? Males. Is it clear? Males, generally the gender, males are more at the risk of stroke than females, or other cardiovascular risk than females. The next one is postmenopausal. Generally, you need to know that what females are protected as a result of estrogen, and then when females arrive at the level of menopause, they have the same risk of cardiovascular incidence as males. Is it clear? Now, other we have sickle cell disease. Sickle cell disease is also another non-modifiable. Is it clear? And then we have factor 5 Leiden deficiency. Is it clear? So you have factor 5 Leiden hyperstimulation, or malfunctioning. So that factor 5, normally these are and they are involved in the cardiolipin disorder, or it's also a form of systemic lupus erythematosus. Is it clear? Where you have cardiolipin, or it's called an antiphospholipid syndrome. In cases where you have antiphospholipid syndrome, you have abnormal blood clot formation that is going to result to clotting everywhere and can occlude the blood vessels. Is it clear? That is when you're already on atherosclerosis. Now, the next one, we have the modifiable risk factors. Generally, for you to cram the modifiable risk factor, use the mnemonics HARDS. Is it clear? The first H is for hypertension. Is it clear? The next H is for so we have hypertension, then we have alcohol consumption, is another cardiovascular risk, then we have dyslipidemia, and we have diabetes mellitus. Is it clear? Then we have sedentary lifestyle, and then we have smoking. So generally, these are the modifiables and the non-modifiable risk factors associated with atherosclerosis, which can result to ischemia. Particularly, since you are discussing of stroke, it's going to result to ischemic stroke. Is it clear? Now, we need to know that what. So, apart from this traditional or the common cardiovascular risk factors, we have novel cardiovascular risk factors that can be associated with stroke or any other ischemia, like ischemic heart disease or peripheral vascular disease. Is it clear? Now, the mnemonics is going to be high, opaque. Is it clear? So that is the mnemonic for the new cardiovascular risk factor. The first H is for HIV. The next H is for left ventricular hypertrophy. The I is for chronic inflammation. When you have chronic inflammation of the vessels or of the structure, particularly the vessels, it is I. Is it clear? Chronic inflammation, or when you have a vasculitis. U is for hyperuricemia. Is it clear? U is for hyperuricemia. P is for proteinuria. A now after proteinuria, A is for so K first is for kidney failure. So when you have a kidney failure, it's going to be associated with the novel, and then A is for anemia. Is it clear? So those are the different elements that you have to note when you are taking a history of a patient that has a cardiovascular risk. I think of atherosclerosis. You have to find for all these different elements from your identification and your past history. Is it clear? So you must identify the different risk factors that are associated based on your history. You should identify the different risk factors associated with the disease. Is it clear? So those are the different elements. So for the risk factors for atherosclerosis. Now you need to know that what the stroke is not just having ischemic stroke is not just having atherosclerotic mechanism. It can also be of the second mechanism, which is cardioembolic. Is it clear? Now cardioembolic mechanism is mostly common